Hello, my name is Kate Collins, and this is my medical terminology presentation on Meniere's disease. So what is Meniere's disease? Meniere's disease is named after French physician Prosper Meniere, and he theorized that attacks of vertigo, ringing in the ears, and hearing loss came from the inner ear rather than from the brain, which was generally believed at that time. So Meniere's disease is a buildup of endolymph in the vestibular membrane, which causes increased pressure, also known as endolymphatic eye drops. So as I mentioned, it's increased endolymph in the ear, and this can stretch and rupture the membrane, the vestibular membrane, and this can cause mixing of fluids within the ear. So potassium-rich endolymph mixes with potassium-poor paralymph and prevents depolarization and damages the membrane. Without depolarization, there are no neurotransmitters released into the synaptic cleft, so no action potentials can be made. This leads to hearing loss and impaired balance. Luckily, Meniere's disease is very rare, with roughly only 615,000 or 0.2% of the US population having it, and it's more common in ages 40 to 60. Okay, starting with the anatomy of the ear, this is the basic anatomy. So you have the outer ear, which is the visible part of the ear, the middle ear, which transmits sound waves into the inner ear, and the inner ear, which contains the hearing and balance systems. That's the one we'll be focusing on the most. So here's more of the anatomy of the ear, but the part we'll be focusing on the most are the semicircular canals, the cochlea, and the vestibule. So as I mentioned before, there's endolymph and perilymph within the ear, and the endolymph is high in potassium ion concentration and low in sodium ion concentration, and is found within the cochlear duct where it surrounds the hair cells. The perilymph is the opposite, and it has low potassium ion concentration and high sodium ion concentration, and is found within the vestibular duct and the tympanic duct. So here's a picture where the blue is the perilymph and the red is the endolymph. And as we know from medical terminology, peri means around, endo means within, and lymph is clear fluid. And we can see here how the perilymph is around the endolymph. And within the endolymph, we have the organ of Corti, which contains the hair cells, and the hair cells are where the action potentials occur so we can hear and have balance and equilibrium. And the cochlear nerves is what sends these signals from the hair cells to the brain. Possible causes. The cause of Meniere's disease is unknown, and it's not exactly clear what causes endolymph fluid to build up in the inner ear, but these are a number of possible causes. So poor fluid drainage, which could be from a blockage or irregular ear shape; genetics, because one has a higher chance of getting Meniere's disease if someone in the family already has it; autoimmune disorders; and viral infections. However, there is no single cause that has been found, and it's likely a combination of causes that leads to Meniere's disease, but more research does need to be done in order to determine a real cause. Symptoms of Meniere's disease: otalgia, which is ear pain; cephalalgia, which is headaches; ear barotrauma, which is pressure in the ears; tinnitus or tinnitus, which is ringing in the ears; vertigo, which is spinning and dizziness episodes; disequilibrium, which is the feeling of being imbalanced; hypertension, also known as high blood pressure; hot flashes and nausea; and high-frequency sensory neural hearing loss, so difficulty hearing high pitches. Treatment. There are a number of treatments that can be used depending on the severity of the Meniere's disease, with some people really suffering from vertigo. And in that case, surgery is an option with a labyrinthotomy or labyrinthectomy. So that meaning an incision or a surgical excision of the labyrinth in the ear. Some less extreme options are diet, so limiting salt, caffeine, and alcohol can reduce the symptoms and the pressure in the ears. Steroid injections can help with balance deficits. Prescription drugs and medicine can help reduce fluid buildup and dizziness. Hearing aids can be used to combat hearing loss that's caused by the disease. And vestibular physical therapy and rehab can help improve balance issues. However, Meniere's disease is chronic and there is no cure. So if one has this, they can be managing the symptoms for the rest of their life. And that was my presentation. Thank you so much. Here's a list of resources that I used.